Hi, and good morning. This is Dr. Tom Kang from Puget Sound Periodontics. This morning I'm going to be reviewing for you our comfort protocol, or what we call our pain management protocols following dental surgery. It is the goal of our providers that patients are able to have the minimal amount of discomfort possible following treatment in our office. Now, the scale and scope of the procedure that you've had is going to be different from individual to individual. So as such, there's no one-size-fits-all protocol that we use for all patients. You may need to take less or more medication than another patient, having even had the same procedure as you. But this pain management protocol is used to help outline a non-narcotic based protocol for the management of discomfort, but allows you to stack medications or take multiple medications at one time to address your discomfort level as it diminishes from potentially significant to moderate to mild to really none at all. Now, the most common medications that will be prescribed in our office are as follows. Ibuprofen, which can go under a couple of different trade names, including Advil or Motrin. This is a non-steroidal anti-inflammatory medication, and it's a very effective one, and it really is our primary medication used for the prevention of postoperative discomfort. Now, right after your procedure, we want you to go ahead and take the prescribed medication that was dispensed to you. In addition to ibuprofen, a second medication that's often used is called Tylenol or acetaminophen. Now, this is not a prescription. This is an over-the-counter medication that you should pick up in preparation for your visit, or perhaps you already have around the house. This medication provides the maximum pain relief when it's been stacked or taken in conjunction with ibuprofen. Now, finally, as a medication of last resort, oxycodone or hydrocodone may also be prescribed to you. Now, typically in our office, we'll provide these medications in a pure form so that they can be stacked along with the ibuprofen and Tylenol. So in this way, if you're only managing mild discomfort, you may only be taking the ibuprofen, for instance. And if your discomfort is a little bit more significant, you may stack that ibuprofen and Tylenol together. And then finally, if you're having some breakthrough pain, we may recommend that you stack on top of those. So taking at the same time the oxycodone that was prescribed to you. This pain management protocol is provided to you in the form of a document, but can also be found on our website. If you go to pugetsoundperio.com as indicated in the link here, you'll click on patient resources, and under patient instructions, these instructions will be there for you in detail. In some cases, a corticosteroid may also have been dispensed for you, and we typically reserve that for patients where the pain is really going to be significant, where it's a very large procedure. Now, each of these medications do have some contraindications, so if you have liver disease or cirrhosis, we'll want to avoid the Tylenol. If you're on blood thinners, we may need to avoid the ibuprofen, or at least stop the blood thinner during the time that you're on the ibuprofen. Finally, with a corticosteroid like dexamethasone or prednisone, if you're diabetic, please let your doctor know. Additionally, if you're dealing with any significant discomfort, or I should say bruising or swelling around the area, there are some homeopathic remedies that we recommend as well. Arnica montana is a medication that can be used topically, like in the form of a cream. Additionally, you can take a supplement of Arnica montana. Finally, making sure that you're using ice in the 24 hours after treatment, and really transitioning after about hour 48 to some kind of a warm compress is a great way for managing this discomfort. A dosing schedule for medications is outlined for you here. So if you have had any type of a sedation associated with your procedure, we want you to avoid the use of a narcotic for a full 24 hours. So initially, what we would do is we would recommend right after surgery, you're going to take one of the 600 milligram ibuprofen, or if 800 milligrams was dispensed to you, that would be a second option. And we also want you to go ahead and take 2 tablets of 500 milligram Tylenol. And 500 milligrams is the formulation that they would normally provide to you at the grocery store. So this is immediately following surgery. You want to take 1 ibuprofen and 2 Tylenol. And as it says here, you don't want to take that narcotic initially. After 6 hours, you can go ahead and supplement again with 1 additional ibuprofen, and 2 additional Tylenol. And you just want to assess your pain level. We want to stay ahead of that pain over the first 24 hours. If you're noticing then that you're just not having very much discomfort, you can start to taper off the medications. Of course, remembering that you only want to add the narcotic at around hour 24 if you've been sedated, or hour 12 if you were not sedated. Okay? Well, thank you very much. As mentioned before, if you have any kidney, liver, or bleeding issues, please make sure to disclose these to us so we can modify your comfort protocol as needed. And we hope this helps make your experience following surgery as comfortable as possible.